Megamind.
Thank you for the nice presentation. Today, I would like to share you 3 cases which I completed by using MegaGen Implants. But before I start, I want to share you, this is the city where I come from, Antalya, near the Mediterranean Sea. One of the most popular cities, touristic cities in the world. And this is my humble clinic with 3 chairs. I work with my wife, she's an also orthodontist. In the cases which I will show you, she helped me a lot and I want to thank her. Okay? Now, these are the 3 cases that I will share you today. And I want to keep it simple and short. And I want to explain these cases in direct way. Okay? And I want to keep in the given time, 15 minutes. Okay? This is the first case in a total extraction case. I will give you the details. The second case and the third case is a multidisciplinary case, which I completed with orthodontics. Okay? Here's the case 1. He is 43 years old and systemically healthy. He's non-smoker and he has huge periodontal abscess in nearly all over the teeth. And of course, he has aesthetic concerns. He's a young patient and he desired to have fixed teeth. And we can see the intraoperative view, okay? If you see on the panoramic radiograph, there are huge bone loss, and our decision is total extraction for this patient, and to give him a fixed solution, okay? Then, due to the gummy line, you will see from the other photos, I will plan crest reduction on maxilla. Then, early implantation, not immediate implantation. Of course, it can be a choice, but in this case, early implantation and immediate loading of the prosthesis. Then, 5 enriched implants in maxilla, 6 enriched implants in the mandible. And our plan is to give him 4 months later fixed prosthesis. After the extraction, you can see the healing of the soft tissue. Then, we raised the flap, we did the bone reduction to hide the connection of the prosthetics and the soft tissue under the lip, and we placed 5 implants in maxilla, and we connected and torqued the multi-unit abutments in a suitable position, and we give him the immediate prosthesis at the same day, 4 hours later. 3 weeks later, after the maxillary surgery, I did the lower implants. We placed 6 enriched implants on mandible. And after 4 months of the maxillary surgery, these are the permanent bridges, metallic supported porcelain bridges. And these will connect to multi-unit abutments and between an intermediate abutment, tie-base abutment. Here is the soft tissue intraoperative view before I deliver the prosthesis. And this is before-after of the cases, which I completed with multi-unit abutments and fixed prosthesis. And this is the before and the after photographs, radiographs of the patient. In totally, it took 6 months to complete this case. And this is the before and after smiling photograph. As I told you, with the crest reduction, we hide the connection under the lip. So it's a more charming smile. And second case, we'll continue with second case. She is 40 years old and systemically healthy, and periodontal destruction on tooth number 22, 27, and 28. And if you look closer to the number 22, she's been visiting a periodontist for 10 years, but the only treatment that she received is subgingival cleaning and following, but she can't even bite anything with his front teeth, and she wants a permanent solution for this situation. So, my treatment plans, of course, I cannot keep number 22, and in this case report, I will focus on 22, okay? Vertical movement of palatinal bone of number 22 by orthodontic extraction to gain more bone on the palatinal side, because in the intraoperative intraoral examination with periodontal sounding, there was no bone on the buccal, mesial, and distal side, but there was slightly bone on the palatinal side. But again, it needs to be augmented. Then, for enrich implants and horizontal GBR, guided bone regeneration work number 22. Soft tissue augmentation, manipulation, temporary crown, and permanent crown. Okay? Here we started with orthodontic extraction. Of course, we did first initial periodontal treatment, endodontic treatment, because in every month 1 millimeter we extracted the tooth 1 millimeter and cut from the incisal edge. 1 millimeter and cut from the incisal edge. Okay? The main purpose of this treatment, as I told you, to movement of the palatinal bone 2 or 3 millimeter to the coronal side. And as you see, 9 weeks after extraction of the tooth, the soft tissue healing completed. And we raised the flap. As you can see, the palatinal bone is increased. So, what happened in this scenario? Now, with the help of orthodontic treatment, I can do a horizontal augmentation anymore. I don't need a vertical augmentation, which predictability is lower. Okay? Now, I did a more predictable surgery with papilla sparing incision. It would be nearly impossible without this orthodontic extraction. Okay? Then I placed the implant in the 3D position. As you see, on the buccal surface, I placed autogenous bone with sandwich technique and xenograft on the buccal side and collagen membrane to cover them and fix the collagen membrane with titanium pins. And close the area in a more minimal invasive way. This is just after the operation, temporary restoration of the patient, a removable Essex plaque, okay? And 6 months after implant surgery, I did the uncovery. I placed healing cap with a modified roll technique. Again, not to touch the papilla, just roll the crestal soft tissue under the buccal side to augment 1 or 1.5 millimeter more. Then, 2 days after the uncovery, I just finished the temporary crown to start the shaping of the emergence profile, okay? Now, 8 weeks after uncovery and shaping the soft tissue, you can see the panoramic radiograph and well-integrated implants with any little bone resorption, okay? And this is the clinical result after finishing of the restoration. A good harmony with the soft tissue, pink and white aesthetics. Also, I would like to thank my technician for this beautiful harmony. And these are the photographs just at the day of the crown placement. Okay? These are all screw-retained crowns. Only lateral is zirconia-supported porcelain crown. The other ones are metallic-supported porcelain crowns. And this is the final result from different angles. This is the before and after. 17 months after crown delivery, again, for the follow-up, we can see 0 bone loss on the implants, even some bone over the platform. And again, the result is perfect, and the patient and all of us are very happy. And, yes, here we go. This is the last case. Again, this is a multidisciplinary case. This patient, she has a severe dental phobia. That's why she postponed the dental treatment too many years. She's 42 years old, no systemic disease, and she has extensive periodontal destruction. She has deep bites, and due to this deep bite, there is a chronic occlusal trauma on the anterior teeth. And as you see, there are huge deep pockets, more than 10 millimeters, in all over the 3 incisor teeth. Okay? That's why my treatment plan is that. Extraction of 3 hopeless teeth. Oral hygiene motivation, of course, very important in this case, very important. Scaling and root planning, and correction of deep bite with orthodontics. One of the most important steps in my case, in this case, is this step. And dental implants, of course, there's a big bone destruction and guided bone regeneration. Again, second stage surgery, shaping the soft tissue for natural emergence profile, and screw retained permanent crowns. Okay? Now, after extraction, I plan an augmentation, so I want good soft tissue healing. 6 weeks was enough for this patient. You see the intraoral view after 6 weeks. Then I placed 2 MegaGen implants for the anterior teeth, as you see. But there is still bone destruction around the implants, especially for the tooth number 11. Both on the distal side and the buccal side, there is bone destruction. But with 50% autogenous bone and 50% xenograft, stabilizing the area with, again, collagen membrane and titanium pins, and passive closure of the flap. Okay? At the same surgery, I did the sinus lift and single implant placement for posterior teeth. This is after the healing of the peri-implant tissues, custom impressions. As you see, the permanent restorations, metallic supported permanent restorations. Again, in this case, there can be another solutions, but I did in this way. You see the soft tissue contour, which just before I delivered the permanent crowns. And this is the restoration at the insertion, day of insertion. As you see, we corrected the deep bite. It's easy for anterior guidance, which will guarantee the occlusal forces for years, okay? And we can compare the day 0, day of restoration, and 4 months after the restoration, the soft tissue contours and the harmony. Again, after more than 1 year, 13 months after restoration delivery, we can see there is no little bone loss around implants, 0 bone loss. And over the platform, again, we have some bone. And this is very good for long term. And if you compare just beginning of the treatment, we can see the soft tissue healing and the restorations. And thank you for your kind attention, and thank you for the organization committee and MegaGen Turkey for inviting me here. And it was a great honor to be here with you. Thank you very much.
MegaMind.